What would you do if at this very moment you felt a crushing pain in your chest and you were completely alone at home? There is no one with you. Your phone is in the other room, and you have between 8 and 10 minutes before your heart could suffer irreversible damage. 65% of people who die from a heart attack die before reaching the hospital, and the vast majority of them did not die because there was no solution. They died because they did not know what to do in the first few minutes. In the next few minutes, I am going to teach you the 3 specific techniques that we doctors know, and that any person, especially if they are over 60 years old, should know by heart. Techniques that have saved real lives, some of them in situations where no one else was present. But before continuing, I need you to understand something. What I am going to tell you today is not in the family doctor's brochures. It is not what they tell you in a 5-minute consultation. It is what I would explain to my own father if I had to prepare him for the worst case scenario possible. So stay with me, because what you are going to learn today could literally be the difference between life and death. I am Alejandro Gomez, and I have been practicing clinical medicine for more than 20 years. I have worked in emergencies, I have been in coronary care units, and I have had very difficult conversations with families who arrived too late. Too late not because the heart attack was inevitable, but because the person who suffered it did not know how to act, or worse yet, acted incorrectly. And that is what I want to change with you today. Permit me to tell you something that deeply marked me at the beginning of my career. I remember a patient, I am going to call him Manuel, 68 years old, retired, active, with no serious cardiovascular history. A man who went on his walks, who watched his diet, who came in for regular checkups, a man who did everything right. One Tuesday morning, his wife went out to do the grocery shopping. Don Manuel stayed home alone, and half an hour later, he began to feel a strange pressure in the center of his chest. He thought it was heartburn. He lay down on the couch, tried to rest. When his wife returned an hour and a half later, Don Manuel was unconscious. What could have been a heart attack with a complete recovery turned into permanent heart damage. He did not die, but his quality of life changed forever. What failed? Not his heart. What failed was knowledge. Don Manuel did not know what to do, and that lack of knowledge cost him a part of his heart forever. And look, Don Manuel is not an isolated case. It is the norm. According to the World Health Organization, cardiovascular diseases kill nearly 18 million people every year worldwide. Myocardial infarctions alone are responsible for approximately 9 million of those deaths. And the fact that impacts me the most as a doctor, more than half of those people die before reaching the hospital. And the average time it takes a person to call emergency services from the onset of symptoms, measured in studies around the world, is between 2 and 4 hours, 2 to 4 hours, when every minute literally counts in seconds. There is a phrase we cardiologists use, time is muscle. Time is muscle. Every minute that passes during a heart attack, the heart loses cells that will never recover. But today, we are going to break that cycle. We are going to give you the knowledge that will allow you to act and act well, even if you are alone. To understand what you have to do when you have a heart attack, first you have to understand what is happening inside your body. Because when you understand the mechanism, everything else makes sense. Allow me to use an analogy that I use with my patients, and that they never forget. Imagine that your heart is a huge city with millions of workers, the cells of the heart muscle, who work 24 hours a day, 365 days a year without rest. To function, that city needs constant supplies, oxygen and nutrients. Those supplies arrive through special highways called coronary arteries. Now then, what happens when one of those highways is blocked? Over years, a substance called atherosclerotic plaque has been accumulating on the walls of those arteries. Imagine it like the rust that accumulates inside an old pipe. A little cholesterol, a few inflammatory cells, calcium, all forming a crust on the arterial wall. For a long time, that plaque is stable there without causing visible problems. But there comes a moment when something destabilizes it. It could be a spike in blood pressure, intense emotional stress, a sudden physical effort, and that plaque ruptures. And here is where the drama begins. When the plaque ruptures, the organism interprets that rupture as a wound and does what it always does with wounds. It sends platelets to close it. Platelets are like the emergency workers of your blood. They accumulate rapidly at the site of the rupture and form a clot. The problem is that this clot, instead of repairing something, completely blocks the artery. At that moment, everything that was irrigated by that artery stops receiving oxygen. The millions of workers in that area of the city stop receiving supplies. And now comes what very few people know. The cells of the heart muscle begin to die in a matter of minutes, not hours, minutes. At 20 minutes of lack of oxygen, the first cells are unrecoverable. At 40 minutes, the affected area begins to grow significantly. At 6 hours, if there is no intervention, a large part of that tissue can become permanently necrose. That tissue does not come back. The heart does not have the ability to regenerate like other organs. What dies, dies forever. Now you understand why, when you feel the symptoms of a heart attack, every second is literally heart muscle that you lose or that you preserve. The good news, and this I do want you to engrave in your mind, is that nowadays, if action is taken quickly, medical teams can open that artery, remove the clot, and restore flow in less than 90 minutes from the time you arrive at the hospital. The procedure is called primary angioplastia, and it can give you back practically a healthy heart. But for that, first, you have to arrive. And to arrive, you need to know exactly what to do in those first crucial minutes when you are alone. But before telling you the 3 techniques, I need to ask you for something. If you find this video useful, and I think it will be, subscribe right now to this channel. Press the red button that you have down there. I do it for a very simple reason, so that you don't miss any health advice tailored to you. Every week I publish videos like this one, designed specifically for people over 60 years old with rigorous medical information explained in a way that is truly understood. And tell me in the comments, write a 1 if you are liking this video or a 0 if you think I can improve it in something. It is the only thing I need, a number. And that helps me enormously to keep creating content for you. Now, yes, the 3 techniques. The first technique, and the most important one, the one that surpasses any other, is what I call the emergency protocol of the first 60 seconds. It is not complicated, but it has a specific order, and that order can be the difference between surviving or not surviving. Step 1, recognize the symptoms and do not ignore them. This is the most frequent and most deadly mistake that people make. The symptoms of a heart attack are not always what you see in the movies. It is not always a fulminant pain that throws you to the ground. Often, especially in people over 60 years old and even more so in women, the symptoms are much more subtle. What are they? First, pressure or a feeling of weight in the center of the chest. It is not always an acute pain. Many patients describe it as, someone is squeezing my chest with their hand, or I have a slab on top of me. That pressure can last more than 20 minutes. Second, pain that radiates. It can go toward the left arm, the most well-known, but it can also go toward the jaw, toward the neck, toward the back, or even toward the right arm. Don Manuel, the patient I spoke to you about earlier, described a dull pain in his jaw before losing consciousness. Third, sudden cold sweating for no apparent reason. Your body sweats cold when the autonomic nervous system is activated in response to cardiac suffering. It is a red alarm signal. Fourth, nausea or a feeling of dizziness. Many patients, especially women, experience nausea as the main symptom without chest pain, and they interpret it as indigestion. Terrible mistake. Fifth, a feeling that something is going very wrong. This sounds imprecise, but we cardiologists know that there is what patients describe as vital anguish, a sensation of impending death that the body itself generates. If you feel it, do not ignore it. And now I want you to engrave this in your memory forever. If you are over 60 years old, have cardiovascular risk factors like hypertension, diabetes, high cholesterol, or past smoking, and you feel any combination of these symptoms that last more than 5 minutes, it is a heart attack until proven otherwise. Do not convince yourself that it is a muscle contracture or heartburn or stress. In medicine, we have a principle. When in doubt, act as if it were the worst. Because if it is the worst and you do not act, there is no turning back. Step 2, call 112 or the emergency number of your country immediately. This is the most critical step, and I say it with all the letters. No technique that I teach you today replaces the call to 112. The techniques that come after are complementary. They are bridges of time while you wait for help. But the call is the first thing. Dial 112. If you can do it while you walk toward the phone, do it now. When they answer, Say these exact words. I think I am suffering a heart attack. I am alone. My address is... And say your complete address with the apartment number if there is one. The 112 operator is trained to guide you. Do not hang up. Keep them on the line with you. They can give you instructions in real time while the ambulance arrives. And if you lose consciousness, they will know exactly where to find you. Here is a practical detail that very few people know and that can save your life. Unlock the door of your house before the emergency services arrive. This sounds obvious, but in reality, many emergency teams arrive at a closed door with the person unconscious inside. The time that is lost breaking down the door can be decisive. So when you call 112, go to the door, open it, or at least unlock the latch, and then sit down. Step 3. The position that reduces the cardiac load. Once you have called 112 and you have opened the door, there is a specific position that you must adopt and that has a very clear physiological basis. Do not lie flat on your back on the floor. I repeat, do not lie flat on your back. There is a very widespread myth that you have to lie down. It is understandable. Instinct says, I feel bad, I lie down. But in the context of a heart attack, lying flat on your back can increase the work of the heart for hemodynamic reasons. When you lie down completely, the venous return to the heart increases, and a heart that is already suffering has to work harder to handle that volume of blood. The correct position is called the modified Fowler's position, and it is very simple. Sit on the floor or in a firm chair. If you are on the floor, lean your back against the wall, bend your knees with your legs slightly elevated if you can rest them on something, your arms resting at your sides. This position reduces cardiac preload, meaning the amount of blood that the heart has to pump with each heartbeat, and allows you to breathe with greater ease. Think of it this way. If your heart is a pump that is failing, do you overload it with work, or do you help it work as little as possible while the repair team arrives? The answer is obvious. Help it work as little as possible. Stay in that position. Try to maintain calm. Do not make physical efforts. Do not try to walk to the hospital. Do not call 10 people on the phone. Conserve energy for your heart. The second technique is one of the most studied and most effective pharmacological interventions that exists for the pre-hospital management of acute myocardial infarction. I am talking about aspirin, and I know what you are thinking. Doctor, aspirin, that medicine that is so common? Yes, that one. But let me explain to you why and how it works, because when you understand it, you will never again underestimate a single aspirin tablet. Remember what I explained to you before. In a heart attack, the main problem is a clot formed by platelets that blocks the coronary artery. Platelets are those blood cells that accumulate to repair the rupture of the plaque. Aspirin, whose active ingredient is acetylsalicylic acid, has an extraordinary property. It irreversibly blocks the activation of platelets. It does this by inhibiting an enzyme called cyclooxygenase 1, which is fundamental for platelets to aggregate with each other. Put simply, aspirin tells the platelets, stop accumulating. It deactivates the mechanism that is building the clot that is killing your heart. The clinical studies are conclusive in this regard. The ISIS-2 study, one of the largest ever conducted on heart attacks, demonstrated that the early administration of aspirin reduced mortality from heart attacks by approximately 23%. Almost 1 out of every 4 patients who otherwise would have died survived thanks to a single tablet taken on time. 23% with a pill that costs cents. Now then, you have to do it right. Because if you take aspirin incorrectly, part of its effect is lost. How is it taken correctly? The recommended dose in the acute context is 300 milligrams. A standard aspirin of 500 milligrams is too much. Half can be used. A children's aspirin of 100 milligrams may be insufficient. The ideal is to have a 300 milligrams or 325 milligrams aspirin at home. And here is the fundamental detail that makes the difference. You must chew it, not swallow it whole. Chew it. Why? Because when you chew the aspirin, it disintegrates in the mouth, is partially absorbed through the sublingual mucosa, and reaches the bloodstream much faster than if you swallow it whole and it has to pass through the stomach. We are talking about a difference of minutes in bioavailability, and you already know that every minute counts. Chew it as if it were a cracker, then swallow. It's that simple. Now, for the important warnings, because this is medicine, and in medicine, nuances save lives. Who should not take aspirin? First, people with a known allergy to aspirin or anti-inflammatories. If you have ever had an allergic reaction to aspirin, do not take it. Second, people with an active peptic ulcer or active gastrointestinal bleeding. Aspirin can worsen bleeding. Third, people who already take anticoagulants, such as Sintrom, acenocumarol, or the new oral anticoagulants like apixaban or rivaroxaban. In this case, adding aspirin without medical indication can significantly increase the risk of hemorrhage. For this reason, and this is advice that I always give in my consultations, speak with your doctor during a routine checkup about whether you should have aspirin at home in case of a cardiac emergency. Let it be your doctor who indicates it for your specific case. Let it be a decision made coolly, calmly, with knowledge of your medical history. But if you are a person without these contraindications, without allergies, without anticoagulants, and you feel the symptoms of a heart attack, and you have aspirin at home, you chew it, and you win invaluable time while you wait for 112. There's something else I want to mention to you here because I see it on social media and it worries me. There are videos that recommend taking other analgesics like ibuprofen or diclofenac instead of aspirin. This is incorrect and potentially dangerous. Ibuprofen, in fact, can interfere with the anticoagulant effect of aspirin, and in some studies, it has been associated with worse outcomes in heart attacks. Neither ibuprofen nor paracetamol nor any other analgesic. In the context of a heart attack, the only option with solid scientific evidence is aspirin. Save that fact, share it with your family. The third technique is perhaps the most unknown and also the one that generates the most confusion, because there is a technique that has been circulating on the internet for years, from WhatsApp chains to viral videos, which is presented as the technique that doctors don't want you to know. I am referring to the so-called cough CPR or RCP with cough, and I am going to talk to you about it with total honesty, because my job is not to tell you what you want to hear, my job is to tell you the truth. The theory of cough CPR says that if you feel you are going to lose consciousness during a heart attack, you must cough repeatedly and vigorously. The idea is that coughing generates a contraction of the thorax that briefly increases intrathoracic pressure, which can maintain a minimal flow of blood to the brain for a few seconds. This idea arose from an article published in 1976 about maneuvers applied to monitored patients in hospital coronary care units under direct medical supervision in the immediate seconds following the appearance of a severe arrhythmia, an absolutely controlled environment. What happened later is what frequently happens on the internet. That fact was extrapolated, simplified, went viral, and reached millions of people as if it were a universal technique to save your life at home. The reality is different. The American Heart Association, the European Society of Cardiology, and the Red Cross are unanimous. Cough CPR is not recommended as a first aid technique for the general population during a heart attack, and there are several compelling medical reasons for this. First, a myocardial infarction and cardiac arrest are not the same thing. A heart attack is an arterial obstruction. Cardiac arrest is when the heart stops beating in a coordinated way. Coughing may have some theoretical role in imminent cardiac arrest, not in the heart attack itself. Second, coughing vigorously when your heart is already suffering can increase the oxygen demand of the heart muscle and worsen the situation. Third, if you are already bad enough to lose consciousness, you are probably not going to be able to cough effectively. And the fourth reason, the most important one, if you are thinking about coughing instead of calling 112, you are wasting the most valuable time you have. So cough CPR is not technique number 3. Technique number 3 is something different and is equally backed by physiology. It is called cardiac load control breathing. Let me explain to you why it works. When you suffer a heart attack, panic is a completely natural response. Your brain detects a threat and activates the sympathetic nervous system, the famous fight or flight system. This produces a hormonal cascade, adrenaline, noradrenaline, and those hormones do exactly the opposite of what you need. They increase the heart rate, elevate blood pressure, increase the heart's oxygen demand, all of which means that when panic takes control, your already injured heart has to work harder. It is like asking a car with a broken engine to accelerate to the maximum. Controlled breathing activates the parasympathetic nervous system, the opposite system, the one of calm, through what is called the vagal reflex. Slow and deep breathing can reduce the heart rate, slightly lower blood pressure, and decrease the oxygen demand of the heart muscle. It is not a cure, it is not magic, but in the critical minutes, while you wait for the ambulance, it can be the difference between a heart that works less and one that exhausts itself faster. How is it done? It is very simple. It is called the 4-7-8 technique. In the position I have already described to you, seated, back supported, knees bent, close your mouth. Inhale slowly through your nose for 4 seconds. Do not force it, gently as if you were smelling a flower. Hold the air for 7 seconds calmly without tensing up. Exhale slowly through your mouth for 8 seconds as if you were blowing out a candle that is 1 meter away, very slowly. Repeat this cycle over and over again. 4, 7, 8. While you breathe, repeat mentally, I have called 112. They are on their way. I just have to stay calm until they arrive. That is not empty autosuggestion, it is neuroscience. Internal language modulates the activity of the nervous system. Studies on pain management and acute stress consistently show that people who maintain a reassuring internal dialogue have less severe physiological responses. I have to tell you something about a patient whose name was Doña Consuelo, 72 years old. She had lived alone for 8 years, since her husband died. She was a retired school teacher, an extraordinarily lucid and prepared woman. She had come to one of my talks on cardiovascular health and had taken notes. She carried the number 112 on the first speed dial of her phone. One Wednesday afternoon, she felt the pressure in her chest. She recognized the symptoms. She called 112 before 2 minutes had passed. She opened the door, sat down on the chair in the hallway, and waited, breathing slowly. When the paramedics arrived 9 minutes later, Doña Consuelo was conscious, oriented, and with a relatively stable pulse. They took her in the ambulance, performed an angioplasty, and 72 hours later she was calling me to tell me what had happened. She told me something I am never going to forget. Doctor, the only thing that kept me calm was knowing what I had to do. Fear didn't beat me because I had a plan. That is the power of knowledge. It doesn't eliminate the risk, but it gives you an opportunity that you otherwise wouldn't have. Before finishing, I want to talk to you about the most common mistakes people make during a heart attack, because sometimes knowing what not to do is just as important as knowing what to do. Mistake number 1, driving to the hospital. Never, under any circumstances. If you are alone and believe you are having a heart attack, do not take the car. First, because the effort of driving increases the cardiac load. Second, because if you lose consciousness at the wheel, the result can be catastrophic. Call 112 and wait for the ambulance. The ambulance arrives with monitoring equipment, defibrillators, and trained staff. A private car does not. Mistake number 2, waiting to see if it improves. I have already said it, but I repeat it because this mistake kills. If the symptoms last more than 5 minutes and are consistent with those I have described, do not wait. Do not convince yourself that it is going to pass on its own. Every minute of waiting is heart muscle that is lost. Mistake number 3, drinking water or eating something. In the context of a heart attack, this can be a problem if emergency surgery is required, as a full stomach complicates anesthesia. Nothing by mouth except aspirin, if applicable. Mistake number 4, making physical effort. I'm going to see if it passes by walking a little. No, absolutely no. Physical effort increases the oxygen demand of the heart. It is the last thing you need at this moment. Sit down, stay still, breathe. Mistake number 5, not opening the door. The time emergency teams lose trying to access your home can make the difference. Open the door before they arrive. There is something that most people don't know and that we doctors do know. Many heart attacks do not arrive without warning. In approximately 50 to 60% of cases, the body sends alarm signals in the preceding hours, sometimes even in the preceding days. They are called prodromal symptoms, and learning to recognize them can give you the opportunity to seek medical help before the emergency occurs. What are these signals? First, inexplicable and disproportionate fatigue. Not the fatigue of having had a long day. I am talking about a deep tiredness that does not match the activity performed. which appears relatively abruptly in people who usually do not feel that way, especially in women. This is one of the most frequent and most frequently ignored symptoms. Second, chest discomfort with effort. If in the last few days you have noticed that climbing the stairs, walking fast, or carrying the grocery bag produces a pressure or a weight in your chest that you didn't have before, that is an alarm signal that deserves urgent medical attention. It is called unstable angina, and it is the frequent prelude to a heart attack. Third, difficulty breathing without an apparent cause. If when doing things you used to do normally, you now run out of breath, the heart may be warning you that something is not working well. Fourth, unusual insomnia with anxiety. Several studies show that the activation of the autonomic nervous system in the hours preceding a heart attack can manifest as difficulty sleeping or a diffuse feeling of unease with no identifiable cause. Fifth, frequent or irregular palpitations. When the heart is at risk, it sometimes generates arrhythmias that the person perceives as irregular heartbeats, skips, or acceleration of the heart for no reason. If you have any of these signals, especially if they are combined, do not wait for it to pass. Call your doctor, go to the emergency room, ask for an electrocardiogram. An EKG can show changes indicating that the heart muscle is suffering even before the heart attack. And in that window of time, we doctors can intervene and prevent the heart attack from happening. The heart attack that is prevented is the best of all heart attacks. I want you to leave this video with 3 things engraved in fire. The first, if you feel the symptoms of a heart attack, you call 112 immediately, open the door, and sit down with your knees bent and your back supported. Do not lie down, do not drive, do not wait. The second, if you do not have contraindications, you chew a 300 milligram aspirin. You chew it, you don't swallow it whole. The third, you breathe. 4 seconds in, 7 of pause, 8 out, and you repeat to yourself that you have done the right thing, that help is on the way, and that you just have to stay calm. Those 3 things, just those 3, can save your life. There is something I take away from every patient who survives a heart attack, a phrase that is repeated in different ways, but always says the same thing. I wish I had known it sooner. Today, you already know it, and that in itself is already a victory. Share this video with someone you love, with your partner, with your sibling, with your friend who lives alone, with your mother, with your father, because the information you have just received has no value if it stays only here. Its value is in reaching more people. If you haven't subscribed to the channel yet, do it right now. Every week I publish videos designed for you about prevention, about medications, about habits, about how to navigate the healthcare system when you are over 60 years old and want to do it right. And remember, write in the comments A1 if this video was useful to you or a 0 if you think I can improve something. It helps me more than you imagine. This video has an exclusively educational purpose. The information presented here does not substitute a consultation with your doctor, nor does it constitute a diagnosis or a prescription. In the face of any symptom of a cardiac emergency, call the emergency services immediately. Before taking aspirin or any other medication, always consult with your healthcare professional.